So Dr. Thomas Gianis
with the Spurs bandana on.
Hey, man, look at that. So what's up, Doc? He's with the. Let me introduce you, Doc. Medical Vein Clinic. You want to hear all of his credentials?
Yes, absolutely.
I pulled up your profile on San Antonio Business Journal.
Oh, God.
Dr. Gianis, board certified vascular surgeon. Let's see, medical degree from Ross University School of Medicine, interned in general surgery at Vanderbilt U, surgical residency at Memorial University in Savannah, Georgia, completed a fellowship in vascular and endovascular surgery at the University of Virginia Medical School. How'd you get to San Antonio?
I had to follow my wife, sir. Happy wife, happy life. So.
Very good. I get it. That's how we got De'Aaron Fox, because his wife's from here and wanted to be here. So good.
I love it, sir. Yeah, Giannis, not Giannis, not as famous, sir.
Correct. Absolutely.
As
all right.
rich, though.
First of all, you guys are so busy, what you do. I appreciate you giving us 10 minutes here. Basically, I demand that you come on here and set my mind at ease, because I was on the ledge yesterday, ready to quit basketball fandom and move to Mexico. So help me. Okay, take us through exactly what's up with Wemby. And what was your reaction when you heard about what he's got going on as a man of your stature and in your position?
Well, first I cried a little bit like yourself. I'm a season ticket owner, albeit in the back row. I yell as loud as everyone else from up there. But I know what everyone else knows, that he has a blood clot in his right arm and his shoulder. I don't know if it was the altitude or something, but in all seriousness, I think he's going to be okay for the long term. I think he's going to come back just like Brandon Ingram did for the Lakers in 2019. I think I would presume, without the being privy to the information that the other doctors are, that he has probably a component of thoracic outlet syndrome that caused this blood clot, which is a treatable condition that I do not think will inhibit him in the long term.
Just based on what you've seen and what you've read, Doc, what would have been the first thing you did once you discovered it? If it was your patient, they brought Wemby to you, what's the first thing you do, and what's the treatments like going on thereafter you're initially in contact with them?
Well, I'm forgetting his autograph, of course.
And a selfie. Because
I know he's got a deal. He can't do that. Keep on his jersey and all this kind of stuff. But in all seriousness, I would immediately start him on a blood thinner, knowing, once getting diagnostic imaging confirming that he does have a thrombosis or a clot in his arm, the immediate thing is to put him on a blood thinner, likely with an IV, which is a lot stronger than the oral medication. You can kind of start and stop it. Figure out the exact extent of his clot. And then, just speeding up kind of the conversation of what I would do is I presume if he does have a clot in his shoulder from thoracic outlet obstruction, I can go into what that is it would involve not only putting him on a blood thinner so that it does not propagate or go back and forward from where the clot is, but actually remove that clot. And we used to do it with surgical techniques, making cuts in the arm and pulling the clot out. But now it can be done with minimally invasive little pokes through the skin and using kind of a balloon to pull the clot out. And at that point, taking some imaging with the X-ray machine, actually kind of like the stuff in this room I'm in right now, to look at the cause of the clot, which is likely an obstruction, kind of like stepping on a hose up in his shoulder joint. That's causing the problem.
Got you. Wow. And the rest of the season, take me through what you know about it, and because when we hear the rest of the season, it obviously immediately scares us. What is the normal recovery time for thrombosis?
Yeah, why is it taking so long for him to?
Wow. So again, I'm not privy to the exact information.
Okay,
of course.
I've definitely pontificated with my friends and my wife and my other colleagues about what I think is going on. And again, I am not privy to this information. I know the facts are he has a blood clot, and then the fact is that he'd be out for the season. But to connect point A and B, if I had to guess, in my expert opinion, is that he has something called Paget-Schroeder's disease. It's basically an effort-induced thrombosis. That means he has a blood clot from an area in his shoulder that's impinging the vein. So the veins coming out of his arm, and this is kind of answering your question, a circuitous route, but the veins coming in his arm merge at his shoulder joint and go back into his chest through the axillary vein, of which the news has said he has a blood clot in. In that area, the vein goes right in between the clavicle, your collarbone, and your first rib. And there's a couple muscles there called the scalene muscles that create kind of a triangle. In that triangle, your nerve, artery, and vein go through. Some people have an extra rib called a cervical rib, or one coming off your neck, but also that triangle just gets very tight from hypertrophy of the muscles or overuse of the muscles. And therefore it creates basically a blockage, just like stepping on a hose, where the blood can't get through that area very well. That causes the blood not to move very quickly and can precipitate a blood clot. So to answer your question, I think that yes, we can remove the clot. Yes, the doctors can remove the clot. They can put him on a blood thinner, and maybe he could have gotten back to working. You know, just like when Chris Bosh had that clot, I was living in Miami in 2019. That is in his leg. That's a very different issue. But with Wemby, I think the issue is probably, if he has what I think he does, that problem needs to be relieved, meaning they have to get rid of that blockage in that triangle, or else it will happen again. And I presume that that is going to need to happen with a surgery that removes one of those muscles. That, don't worry, everyone, it's not a muscle you really need, as well as part of his first rib. And once they do that, he will be able to get back to full force, hopefully crushing it for the Lakers next year, or for the Spurs and us next year. I was confusing with Brandon Ingram. I don't care about the Lakers. Yeah. And get back to crushing it for us next year, because I think we got a chance with him and De'Aaron Fox and Stephon Castle. And
absolutely.
I don't think this is going to impede him in the long term. But I think that the reason, to answer your question, that route is that it's not just going to remove not just need the blood clotting medication, but also removal of the clot and eventually removal of that obstruction that's causing that vein to be obstructed.
Is this bad luck? Is this because of tall people, or is this because because I remember it wasn't too long ago, he fell on the shoulder, he came off. Is it because something happened was it trauma to the shoulder, or is this just bad luck?
So I don't think it's from him being too tall. There are people that have genetic predispositions to other sort of vascular issues when they're very tall, Marfan syndrome and things like that. But the shoulder injury definitely could have played a play. Just having inflammation of the area creates more swelling, and then that triangle gets even tighter from those muscles. You know, it's hard to tell, just like in anything in medicine. You know, it's an art, not a science, but I would presume that at least some trauma contributed to it. But he probably already had a very tight anatomical triangle. But nothing in my understanding or reading or experience shows that he had a genetic predisposition just to his height.
Doc, I'm assuming not all blood clots are the same. Like if he was a 5'9" me, I'm 50. Does that matter? Age, the fact that he's an incredible athlete, how does all that differentiate, or all this condition is very similar no matter who has it?
You know, it does matter in terms of how you fix the problem, in terms of how long the clot is, as well as the you know, this is kind of through it, but we use wires and catheters to remove this. And I was talking to my buddy, I'm like, I hope they got catheters long enough to get to the clot in his arm. You know,
well, that's a legit question.
It is. So it is a legitimate question. But in terms of the management, if this was a 5'6" person or a 7'4" person like Wemby, in terms of management of this actual anatomic problem with that triangle metaphor in his neck, the management would be absolutely the same. Albeit you probably have a much better doctor taking care of it if it's Wemby.
Okay, so you're a season ticket holder.
Yes.
I'm assuming
in the back row, sir. If you can upgrade me, you know,
come on.
Okay. Love me. My kids will love me.
It's okay. Go ahead and flex, baby.
Yeah, it's all good, Doc.
No, but I have a question. So, a man of your stature who knows what you know, you have no problem purchasing season tickets again for next year because you have all the confidence in the world that this kid will be ready to go.
Great question.
Insider knowledge, like buy the stock low. If they're selling them cheaper now, get on board, because I know we're 12th in the West. I read our chances of that first pick. Cooper Flag is maybe 3%, but we got Stephon Castle coming in with De'Aaron Fox. Let's go. Buy low. I'm coming back next season for sure.
Okay. All right. Very good. I feel better. Okay.
Doc, you don't have any idea. Our chat has taken a huge sigh of relief just in these 10 minutes we've had you on, because yesterday we were in full panic mode.
Oh my God.
Yes, sir. Well, you know, I'm not, you know, thoracic outlet is a very subspecialty of vascular surgery, but I would read just like the Brandon Ingram situation, albeit he's not on Wemby's status, not with me and not with the world. But I think that's what he's got. I think that's why he's going to need surgery. He's just going to have to recover from that surgery. And I know you say remove muscles, remove ribs, those are very, very minute issues in movement of his right shoulder. I don't think it's going to impede his physical ability going forward. I'm buying low. I'm going back next season. I'm upgrading my tickets.
All right. Well, how about okay? Very good. Dr. Thomas Gianis, San Antonio Medical Vein Clinic. Thank you. You have done exactly what I
Thank
hoped
you,
you would
Doc.
do, and get my ass off the ledge. Thanks, Doc.
Let's go.
I know
Thank you for having me. Go
you're a
Spurs.
busy man. Thank you, man, very
Yes,
much,
sir.
Doc.
Appreciate
Y'all
it.
have a good day.
Cool.
You too,
Very
sir.
good. There he is, Dr. Thomas G. Okay, that's a guy who knows what's up.
Yeah, so your 8 went down to about a what 3?
No, I mean, it's 5. I mean, you still have to have the surgery,
Well, possibly he did. Look, and be
Thank
clear.
you, Doc. Thank
Be
you, Doc.
clear. He did say, "Look, I don't have any of the information." He was just,
Of course,
he was just kind of,
he's not his direct
yeah.
doctor, but the man does this all the time.
Right, he does this all the time.
Yeah.
But he, so if he doesn't have surgery, he'll be like, "Oh, yeah, doc, y'all had on." But he's just giving off of what he knows.
Yeah.
He's, says
Okay.
it's no big deal.
Okay.
Well, it's a big deal, but he'll be back next season.
All right. He's all excited, going to upgrade his tickets and
You see,
everything.
he started, he had the Spurs bandana on and everything. He was
I
ready.
know,
He was ready to talk ball. He didn't want to talk.
No,
he didn't want to talk. He didn't want to talk to Clot. He's like, "Yo, let's talk ball."
I know.
I like it.
I like it too, man. God, Doc, do me a favor and please subscribe to our show and tell all of your colleagues to subscribe because we need all the subscribers we can get. So thank you, man. I'm gonna make them
What's
my
the name of them?
the San Antonio Medical Vein Clinic.
San Antonio Medical Vein Clinic.
Yes, sir.
If you are looking to expand your business,
Absolutely.
in the building is the place to go.